Representative Moser.
Thank you, Mr. Chairman. Thank you very much for being here today. I very much appreciate your clarification about some of the issues and some of the questions that have come up in the past month or so since we've really started debating this in earnest. I agree with you that marijuana is a plant, like many others, that have gone through the rigorous FDA approval process to become a medication. I'm confused about why marijuana, the plant, should be treated any differently. I know that we've talked about many of the medicinal qualities that are probably in THC, and ongoing research is really what I believe should be front and center for the safety and the effectiveness. We need to know exact indications for a said medication. I would also say that it's probably not a great idea to come to the legislature for your healthcare needs. I am not a doctor, and when I am sick, I go to a doctor or a healthcare provider, not my friends in the legislature. As much as I like all of you, I'm still going to go elsewhere for my healthcare needs. So again, I very much appreciate your clarifying all of the arguments that we've heard. I believe that it's research and science, and not a collection of anecdotes and ad hominems and emotion that we need to be considering this very important issue. On the economic development side, and Chairman Fisher brought up an excellent point. I think that Kentucky in the past year or two has done an excellent job on the economic development side of really bringing more businesses to Kentucky. We have a workforce shortage as it is, and some of it is attributed to the current drug problem that we're having. Is there I guess one question could be, is there a field sobriety test or some sort of quick test that we can do to know whether or not someone is actively under the influence of marijuana if they are on the work site?
So thank you for the question. So there are tests in development. We do not have anything near what we have for alcohol with a 0.08 BAC, mainly because THC metabolizes, as I said, differently in your system, and frankly, different people react in different ways. So it's very difficult to prove impairment. And with alcohol, it's frankly often can be difficult enough also to prove impairment, but we have sort of set a political standard of 0.08 that juries know, and it's very black and white. For marijuana, especially when it comes to driving or the workplace, it's more subjective. And there are trying to be sensitive tests that are trying to detect recent use, which maybe we'll get there, but we're not quite there yet, to be honest.